Hello guys, welcome to medeasy channel. Today we are going to see applied anatomy of brachial plexus. There are two important lesions of brachial plexus. They are upper trunk lesion and lower trunk lesion. The upper trunk lesion, it is collectively known by the term Erb's paralysis. Lower trunk lesion by the term clumsy paralysis. Now let's discuss about upper trunk lesion, that is Erb's paralysis. It's caused mainly due to the excessive increase in the angle of head and shoulder. They form a deformity known as policeman's tip hand. The position resembles the policeman getting bribe from persons. So there are 6 nerves involved in the injury and they commonly form a point known as Erb's point. They are anterior division, posterior division, C5 and C6, nerve to subclavius, suprascapular nerve. The diagram is very much important. You should draw it in university exam. Now let's see the clinical features of Erb's paralysis. First of all, there will be paralysis of deltoid muscle because the nerves supplying them are affected. So there will be hyperadduction of arm. There will also be medial rotation of the arm due to the paralysis of supraspinatus, infraspinatus and teres minus muscle. There will be extension of elbow due to paralysis of biceps brachii. There will be pronation of forearm due to paralysis of biceps brachii. And finally, loss of sensation due to the involvement of C5 and C6 roots. Now let's move to clumsy paralysis. As I have mentioned earlier, it is a lower plexus injury. It is mainly caused due to the hyperabduction of the arm. You can relate that is adduction and this is abduction. The nerve roots involved here are C8 and T1, sometimes C7. Now let's move to the clinical features of clumsy paralysis. Claw hand, due to paralysis of flexors of wrists and fingers. Loss of sensation along the medial border of the hand. Finally, Horner's syndrome, characterized by partial ptosis, meiosis, anhydrosis and enophthalmosis. Let's discuss the terms with detail. Partial ptosis, drooping of eyelids is often known as partial ptosis. Meiosis, they refer to excessive constriction of pupil of eye. Anhydrosis, they refer to the absence of sweat glands. Enophthalmos, enophthalmos is the condition where it causes posterior displacement of eyeball. They occur due to the changes in volume of the orbits relative to its contents. Now let's quickly revise the features of Erb's and clumsy paralysis. Nerve roots involved in clumsy paralysis is C8 and T1, sometimes C7. Nerve roots involved in Erb's paralysis C5 and C6. Muscles paralyzed. In Erb's paralysis, there will be paralysis of deltoid, supraspinatus, infraspinatus, biceps brachii, brachialis, brachioradialis, supinata. Extensor carpi radialis longus. Clumsy paralysis, all intrinsic muscles of the hand. Position of the upper limb or hand. Erb's paralysis, policeman's tip. Clumsy paralysis, claw hand. Sensory loss, it may occur sometimes as mentioned. So in Erb's paralysis along the outer aspect of the arm, clumsy paralysis along the medial border of the forearm and hand. Autonomic signs. Erb's paralysis, it is absent. Clumsy paralysis, there will be Horner's syndrome.